Hello, my name's Sydney, and this is Stephanie.
Hello.
And we'll be doing contraception for diaphragm and cervical cap and spermicide. So contraception, also known as fertilization, is when a male sperm and a female egg meet and develop a zygote resulting in pregnancy. In order to avoid becoming pregnant, barrier methods must be used. There are many different barrier methods to prevent sperm from reaching the female egg. Some burial methods include diaphragm, cervical cap, and spermicide. So in order to obtain a diaphragm or a cervical cap, there must be an active prescription order from a healthcare professional. An OBGYN or a nurse practitioner can write such prescriptions, and once they see that you're a fit candidate for the prescription of a diaphragm or a cervical cap, you'll get fitted. And then to cover the cost, the diaphragm or cervical cap varies depending on the coverage of your insurance policy. So the cost can range from $0 free or to $300, which includes the exam itself. Once a prescription is obtained, most retail pharmacies have the barrier method available, such as Target, Walmart, Rite Aid. So how does the diaphragm or cervical cap work? The diaphragm is a small dome-shaped device made of silicone or latex that fits inside the vagina and covers the cervix. There are two different types of diaphragms that can be used. One is a personalized size diaphragm, which is the one I was talking about when you get fitted at your exam. Or you can have a different type that is one size fits most, which we all know it might not fit everyone, but it fits most people. The cervical cap is a small plastic dome that fits tightly over the cervix and stays in place by suction. Both of these devices need to be used with spermicide. Spermicide is a chemical that deactivates sperm. So they both work. The diaphragm and the cervical cap work both by blocking the sperm from traveling up to the uterus. And the spermicide works alongside of both the diaphragm and the cervical cap by slowing down and killing the sperm. There's many different brands for the diaphragm and the cervical cap, but the most popular ones for the diaphragm is Kaya, and the most popular brand for the cervical cap is called FemCap. So the effectiveness of both of these are pretty effective, but they're not 100% successful. Out of 100 women per year, 18 to 28 women will become pregnant when using the diaphragm or cervical cap method. They work best when they're used correctly and used every time sexual intercourse is engaged. One act of sexual intercourse without the use of a barrier method can result in pregnancy. And an emergency contraceptive is advised if the barrier method breaks, dislodges, or isn't used. Some user knowledge is the diaphragm and cervical cap should be fitted by the healthcare provider, like I once said. The diaphragm is available in one size fits most, but to obtain its most effectiveness, it's best to get a personalized fitted cap. The diaphragm and cervical cap must be in place for 6 hours after sexual intercourse. For the diaphragm, it's not to be in place longer than 24 hours after the sexual intercourse. And for the cervical cap, no more than 48 hours after sexual intercourse. If you're planning to have sexual intercourse more than once within the time frame, reapplication of spermicide is advised for the diaphragm, but not necessarily for the cervical cap. So once you've used the spermicide once for the cervical cap, within that 48-hour window, you should be okay to not have to reapply if you were to engaged in sexual intercourse after the first initial encounter. Since both of these methods do not protect you against STDs, sexually transmitted diseases and infections such as HIV, it's important to go and get examined and checked up regularly by your OBGYN, especially if you are engaging in sexual intercourse with more than one partner.
There are also some pretty significant disadvantages for both the cervical cap and the diaphragm. Both methods must remain in place for 6 hours after sexual intercourse, and this can result in discomfort. Methods also can slip out of place, increasing the chance of pregnancy. and having a baby or gaining 10 pounds or even losing weight may cause the need for a resizing of the diaphragm and cervical cap by a healthcare professional. The ideal candidate for someone for the cervical cap or diaphragm would be those who are not at high risk for HIV or AIDS, have a regular female anatomy, have not recently had cervical surgery, and do not get frequent UTIs. The FemCap website for the cervical cap provides quick tips like how to correctly find the cervix, insertion tips on how to correctly insert the cervical cap, ways to avoid incorrect placement, along with how you are supposed to remove it, which is by grabbing the hook of the cap with one finger and slowly and gently pulling the cap down and out of the vagina. The FemCap website also provides 3 different sizes for women based on their OB history: the pearl, the sapphire, and the emerald. The pearl is for those who have never been pregnant before. The sapphire works for those who have been pregnant but did not deliver by spontaneous vaginal delivery. And the emerald size is for those who have delivered vaginally. On the Kaya website, there is a great quick start guide for safe and easy use of the diaphragm. It explains how much contraceptive gel to add to the diaphragm, how to safely insert it and remove it, and instructions on how to care for it after removal and how long it can be used for after the first application.